बोलो हेलो
వీడియో అప్లోడ్ ఏమో
మళ్ళీ ఏం మాట్లాడదు ఏమంటా
ఒకటే మాట్లాడింది నేను వీడియో ఒకటి
వీడియో ఆన్ చేసినా నేను
అదే అప్డేట్ చేయమని చెప్పింది అర్థం కాలేదు.
This slideshow. Here you go. Here you go. Start. Good evening, everyone. So, good evening, all the participants. First of all, let me thank all the participants for joining this webinar. So, as you all know, today's webinar is on diabetes and cardiovascular disease risk by Dr. Lakkireddy Kiran Kumar Reddy sir, the senior interventional cardiologist at Onus Heart Institute, Champapet, Hyderabad. And as you know, diabetes is considered to be a silent killer because most of the diabetic patients, like whenever they get some even attack also, of course, they will not feel any sensation of the pain. So that's the reason it is called as a silent killer. So how the diabetic patients are affected with cardiovascular disease risk. So today we have Dr. Lakkireddy Kiran Kumar Reddy sir is with us to enlighten us on what are the risks associated with diabetes patients and associated cardiovascular diseases. So I'll request Dr. Kiran Kumar Reddy sir to present on this topic today. Sir, over to you, sir.
Thank you, our CEO Joshi sir. Today we are going to discuss about diabetes and cardiovascular diseases. So now there are two types of diabetes when you see. One is type 1 diabetes and another is type 2 diabetes. So usually whatever we see in adults is commonly is called type 2 diabetes. So what is the difference between these two? Type 2 diabetes is characterized by insulin resistance and relative insulin deficiency. So majority of the cases, what we see in our regular practice or in our surrounding areas is type 2 diabetes. That is more than 90% of all diabetes cases. And type 1 is defined by absolute insulin deficiency, usually which is seen from childhood or in teenagers. Most commonly, the onset of diabetes is very early. So when you see diabetes is globally around 463 million adults are suffering from diabetes in 2019. So why there is rapid growth in the people who are getting diabetes? When you see the incidence and prevalence or people who are living with diabetes is increasing day by day. So it is due to increasing population age. So the mean population of Indians increased from 61 to 69, and increasing rates of obesity and physical inactivity, which is the newer and very big risk factor for development of diabetes and also the cardiovascular problems. So along with these, the longevity of the patients with the disease also is increasing. So that's why the prevalence is also increasing patients who are having type 2 diabetes. And it will affect it is affecting almost more than 700 million people. That is 10.9% of the global adult population by 2045. That is nearly, if you see from 2019 to 2045, the people who are living with diabetes are going to double by 2045. So this much huge increase in the number of people living with diabetes is going to increase. So basic pathophysiology of type 1 and type 2 diabetes, when you see type 1 diabetes, if you see where there are our immune system, like some cells will be there, like bad cells, where they attack the pancreas. So insulin producing cells are there in the pancreas. So in this childhood, due to genetic deficiencies or from hereditary, because of these reasons, so the autoimmune mechanisms are prevailing in our body. So these bad cells will attack the insulin producing cells in the pancreas in early ages of the life. So the cells will get destroyed and there is no insulin production in our body. So this is called type 1 diabetes. So people will develop absolute insulin deficiency. So they don't have any insulin in the body. And when the insulin is not there, the sugar levels will not get controlled. So the patients present with high glucose levels, at least in the early stages of life. So this is important mechanism for type 1 diabetes. But if seen type 2 diabetes, which is most commonly seen in adult population and youngsters, where beta cells are there, but the insulin, they also produce insulin. But what happens, the insulin is unable to act on its receptors on the peripheral organs like fat tissue or muscle or liver. It is unable to act on the glucose absorption or under control of the glucose levels. So this is called as insulin resistance. That is, insulin is present but is unable to act. So this is called relative insulin deficiency, leading to high sugar levels. So what happens simultaneously, these high sugars will again lead to increased production of the insulin from the pancreatic cells. So initially we'll have hyperinsulinemia, but whenever these prolonged duration is there and uncontrolled sugar levels are there, finally these cells also will get exhausted and the cells will die. And finally, even type 2 diabetes patients who are on having long-term diabetes, that is more than long duration of diabetes in type 2 also, they will develop insulin deficiency on the long term. So this is the basic mechanisms of in the difference of action or production in type 1 and type 2 diabetes. So when you see the truth, what are the statistics of diabetes? Almost in 2015 it is like 69 millions, and 2040 it is almost going to double. So almost 128% growth rate of diabetes had been seen in the prior also from 1990 to 13, and even 109% growth in women diabetics and almost 126% in men diabetics from 1990s to 2013. Even if see the projections from 20 to 79 years, now 2019 it is almost 77 million are living with diabetes in India. By 2030 it is reaching 100 million, and by 2045 it is reaching 134 million. So it is almost doubling by 2045. And even the same time, 43.9 million people are having undiagnosed diabetes. See, almost a significant number of people are also living with undiagnosed diabetes, where they don't know that they are having diabetes. So this is important, and almost 1 million diabetes related deaths happened in 2019. So this is a huge number which is impacting the lives of the people who are living with diabetes. Even when you see the age, according to age, from 20 years to almost 18 years, so there is gradual increase in the incidence of the diabetes in both males and females. Particularly, it is more in males. Increase in the diabetes is seen more in males when you see along with the age group. So this is most important. So, and we see Indian map of diabetes and pre-diabetes, almost 20% is dark blue. Southern states, particularly Andhra Pradesh and even Telangana, Tamil Nadu, Kerala, and Karnataka are at even high risk of diabetes. So this is most important. The top one thing is Kerala, followed by Goa, Tamil Nadu, Andhra Pradesh, Puducherry, and even Telangana at 18.1% of diabetes living in these states, particularly Telugu states. Though when you see here is also state-wise prevalence, it is also high in southern states. When you see the awareness is high in Telangana but low in Andhra Pradesh. And when you see the treatment aspects are somewhat good in the southern states who are following treatment strictly, and even the control of diabetes is also reasonably good. So at least some aspect which are in the good time is awareness and treatment and control of sugar levels. At least the southern states are achieving good control of the diabetes. So what is the diagnostic criteria for diabetes? So when you tell the patient is having diabetes, so two few parameters are there. One is fasting blood glucose, which is more than 126 milligrams per deciliter, and they should follow a 8 hours fasting before checking their fasting blood sugar. So that is one criteria. Or 2 hours plasma glucose level, that is after oral glucose tolerance test. So if they are having undergone these tests, if 2 hours plasma glucose level is more than 200, they will be having diabetes. Or HbA1c level, which is important, it is more than 6.5, it is suggested to have diabetes. Or in a patient with classic symptoms of hyperglycemia or hyperglycemic crisis, a random blood glucose more than 200 milligrams per deciliter also fits under having diabetes. So what are the symptoms of hyperglycemia? Like increased thirst, frequent urination, extreme hunger, blurred vision, slow healing cuts and sores, any wounds that are healing very slowly, and fatigue, generalized weakness. So these are the general symptoms of hyperglycemia. Hyperglycemia, that is high blood sugar levels. So if any symptoms is there along with that blood glucose, random blood glucose itself more than 200 milligrams per deciliter, they are having diabetes. There are different types of diabetes even in this type 2 diabetes. One is severe autoimmune diabetes, where they're having very low beta cell function, that is pancreatic cells producing insulin, and they are having usually low to normal BMI, usually seen in younger individuals, and they are higher HbA1c levels. And second is severe insulin deficient diabetes. These people are also having very low insulin producing cells in these people and higher HbA1c levels. Another form is severe insulin resistant diabetes. They're having high BMI, they are obese, and they're having high insulin resistance and significantly increased risk of kidney disease in these people. And fourth one is mild obesity related diabetes. They are also having high BMI and mild age related diabetes. So these are different subgroups even among type 2 diabetes, which is most commonly seen. And you see childhood adiposity. So patients, children who are obese in their childhood and teenagers, they are at most risk of developing any one of the diabetes type 2 subtypes. So that is most important. You should take care of your kids' health. They should be of healthy weight and height, and they should also maintain regular BMI. So these are the other patterns of type 2 diabetes, where there are different physical and managemental aspects based on these things. Because we are discussing obesity, so patients who are having genetic susceptibility to obesity and diabetes, so they are particularly along with environmental factors like energy imbalance, that is nutrient composition, high food intake, maternal obesity, birth weight. All these are important environmental factors. So genetic and environmental interaction is also important. So along with that, expanded fat cells will have lot of inflammatory cells, that is bad cells, where they increase the speed of beta cell function loss, that is loss of insulin producing cells. So particularly abdominal obesity is most important. So anybody having abdominal obesity, they are high prone to develop diabetes. So all these things will lead to loss of insulin producing cells and leading to decreased insulin production, and also decreased insulin sensitivity and increased insulin resistance, finally leading to high blood glucose levels. So this is the factors in obesity, how they are affecting the pancreas insulin producing cells and leading to insulin decreased production and hyperglycemia. So when can you confirm you are like diabetes? So two things are most important. One is blood glucose level and HbA1c. If both are elevated, definitely it is diabetes. If only one plasma glucose level is off in the diabetic range, then it's better to re-examine the levels within 1 month. If both are elevated, it's a confirmed diabetes. If only one is elevated and neither of in the diabetic range, you just only suspect diabetes. Even for HbA1c, if along with HbA1c, if plasma glucose levels are elevated after re-examination, then it is called like confirmed diabetes. In patients having suspected diabetes, then you should reconfirm the levels at least within 3 to 6 months again. So this is the flowchart. Then what are the mechanisms in this diabetic population leading to increased cardiovascular diseases. There are a lot of cellular and molecular level mechanisms like activation of the hormonal systems, where there is the activation of renin-angiotensin system leading to kidney dysfunction, and the increased blood coagulability, increased blood clotting formation will be there in diabetes, and cholesterol abnormalities will be there in diabetes, and the bad cells inflammation, autoimmunity is prevailing, and even the blood vessel wall linings will get dysfunction and develop resistance to the insulin functions. And along with the factors like physical inactivity and bad dietary habits, and another like weight gain, obesity, along with blood pressure, and along with another molecular mechanisms like oxidative stress, where the body organs and cells are undergoing stress levels, and also because of high sugar levels, the adverse products of high sugar levels like advanced glycation end products, all these things will lead to development of cardiovascular problems in the diabetic population. So every system is important for us. So strict control of diabetes is needed to control all these mechanisms and to reverse these mechanisms. So same thing like traditional risk factors, diabetes population also have other risk factors like hypertension, which is nearly in 70% people. So all these things lead to damage to the heart muscle and heart blood vessels, and even brain activation systems, neural activation systems, and linings of the blood vessels will get dysfunctional, and even the blood parameters will get dysfunctional. All of these things lead to microvascular and macrovascular problems. So like macroangiopathy, like where it affects the big vessels, and the microangiopathy where it will affect the very, very small vessels which are inside the main organs of the body. So all these effects from the diabetes lead to damage of our organs and leading to cardiovascular problems. So what is the cardiovascular disease risk in diabetes? So if you see there are different risk factors which also increase the development of cardiovascular problems. Non-modifiable risk factors, that is, you can't modify these. If like genetics, any family history, and race and ethnicity where you were born, the demographics of the place where history of diabetes during pregnancy, you can reverse it. And the reversible factors like physical inactivity, you can reverse by becoming more active. Overweight and obese, you can reduce your weight. Poor dietary habits, you can improve that. Hypertension, you can control. Smoking, you can quit. And the medications or harmful medications, you can quit. So all these factors will lead to development of diabetes related complications. The most common are heart attack and brain stroke. And the next comes the peripheral artery disease, where the blood vessels supplying your legs also will get damaged, and even the nerves supplying your legs and hands, your body will get damaged. That is called peripheral neuropathy. And even kidneys will get damaged, diabetic nephropathy. All the neuropathy and vessel damage will lead to diabetic foot ulcers, and even the eye complications like diabetic retinopathy and cataracts and glaucoma will also increase in diabetic people. So these are huge number of complications where the person with diabetes can develop in future if they don't get controlled it properly. So when you come, cardiovascular disease remains the principal comorbid condition and primary contributor to mortality, that is deaths in patients with diabetes. The cardiovascular diseases like coronary artery disease, heart attacks, brain strokes, peripheral vascular disease, heart failure, even the heart pumping function will decrease, and heart rhythm abnormalities like atrial fibrillation will present. So when you see 2 to 4-fold increased risk of coronary heart disease will be there, and also to the mortality in patients with diabetes compared to patients not having diabetes. So this is huge amount of risk. So diabetes should take utmost care. And there's increased risk of heart attacks, that is myocardial infarction. Nearly diabetes is seen 1 in 3 patients suffering from heart attacks. And even the patients who are having diabetes have worst outcomes, that is worst prognosis when they develop heart attacks. So this is most important. And it also increases the risk of brain stroke by 2-fold increase of brain strokes and peripheral artery disease. And hyperglycemia, that is diabetes, affects approximately 1 in 3 patients with the acute stroke who are suffering with acute brain stroke or having diabetes. And even the mortality, it will increase to 2 to 6-fold increase if diabetes person is developing brain stroke, there are almost like 2 to 6-fold increased risk of complications and mortality will be there in patients with brain stroke. And it independently associated with 2 to 5-fold increased risk of heart pump failure. And even the patients with the diabetes who developed heart failure, they are having the worst outcomes once they develop heart failure. And it is a key driver for morbidity and mortality in diabetic population. And also in patients with atrial fibrillation, that is high heart rate abnormality, it increases the presence of diabetes, increases the stroke rate also by almost 2 to 3.5%. So all the scores in the atrial fibrillation in predicting stroke included diabetes, and they recommend anticoagulation guidelines for patient, that is blood thinners for patients who develop heart rhythm abnormalities. And also risk stratify, you can risk stratify the diabetes patient like very high risk and moderate risk. Very high risk is diabetes mellitus with established cardiovascular disease. That is almost a patient already developed like heart stroke or brain stroke or other target organ damage like left ventricular hypertrophy or chronic kidney disease. These patients comes under very high risk, and high risk people, diabetes duration more than 10 years comes under a high risk, along with any other additional risk factors like hypertension, cholesterol abnormality, smoking, obesity. So if they are having additional risk factors, they comes under high risk. Moderate risk is younger patients, that is less than 15 years with the duration less than 10 years and without any risk factors, they comes under moderate risk. So not only diabetes, presence of duration of diabetes increases your risk, and the presence of any other 1 or 2 additional risk factors will increase the risk to a higher level in patients with diabetes. When you see who are presenting with heart attacks, 1/3 of the patient are having undiagnosed, previously undiagnosed diabetes. So many patients with diabetes will present first event as a coronary, that is coronary event, that is heart attack. So if anybody is presenting with heart attack, if you check, 1 in 3 are having diabetes and they don't know until they are affected by heart attack. So previously undetected diabetes is also common, which is seen up to 20 to 25% in heart attack patients. And hypertension is almost seen in 70% of patients with diabetes people. So it also increases the risk of heart pumping failure by 12 to 14%. So diabetes population who are unable to control their blood pressure. So if your blood pressure is increasing by 10 millimeters, your heart failure risk is also increasing by 12 to 14%. So that much importance is there for strictly controlling blood pressure levels in patients with diabetic people. And is independently associated with a heart rate abnormality, that is atrial fibrillation, and it increases the risk of brain stroke and other thromboembolism episodes. So you see here, death from any cause or death from cardiovascular disease or death from heart attack and hospitalization for heart failure, it is more common in diabetes compared to the non-diabetic population. It is higher seen. Even with advanced technologies from 1999 to 2014, even the incidences of mortality and morbidity decreasing from 1999 to 2014 due to advances in the treatments and diagnosis, but still higher than the non-diabetic people population. And you can also see here a person affecting with acute heart attack, the mortality is higher in diabetic people compared to non-diabetics. And you can also see the incidence of complications is also higher in the diabetic population compared to the non-diabetic population who are affecting with acute stroke. This is another post-admission who are admitted with particularly for heart attack. When you see their blood glucose levels, and the glucose levels are high, the in-hospital death rates are also high if the blood sugars doesn't get controlled properly. So that much importance is there even in acute heart attack episode. So how these are increasing the cholesterol accumulation risk, we already discussed. The endothelial vasomotor dysfunction, where the vessels will not dilate properly, and the vessel layers will get damaged due to accumulation of cholesterol and everything, and advanced glycation end products of the high sugar levels, and even the circulating free fatty acids, free cholesterol in the blood also will cause much adverse effects and increase the systemic inflammation, that is bad cells will increase in our body, increased stress, and even prothrombotic state, that is more tendency to get blood coagulate easily. It will increase in diabetic population, and even the cholesterol levels are high associated with high triglyceride levels and low HDL cholesterol levels and increased LDL particles. All these things will lead to increased cholesterol accumulation in the blood vessels and increased risk of the heart attacks and brain strokes in people living with diabetes. You can see here the lot of failing where the heart failure is from the diabetes risk, who are having high risk to heart failure, hospitalization, and death. There are multiple mechanisms like high blood pressure, muscle becomes weakening, and nerves also can get affected. The small and big vessels are going to affect, and fluid also will more accumulate in our body, and renal failure. All these neurohormonal mechanisms also will increase, leading to more adverse cardiac events in people living with diabetes. So strict control is important compared to less control. When strict control is there with the patient, highly motivation and adherence to prevention and treatment measures, so with strict control, the comorbidities will be less and the complications will be less, and life expectancy will be long, who will control their blood sugars more strictly compared to who will control their sugars less strictly. The complications are high and the life expectancy is short in these people. So cardiovascular risk categories we already discussed. Very high risk who are having diabetes with established cardiovascular disease like brain stroke or heart stroke and peripheral artery disease, or any other target organ damage like kidney failure, or 3 or more major risk factors like age, high blood pressure, cholesterol, smoking, and obesity, or early onset diabetes, that is type 1 diabetes of more than 20 years, will come under very high risk. High risk diabetes duration more than 10 years without any organ damage plus any other additional risk factor. Moderate risk young patients, that is type 1 diabetes with less than 35 years, type 2 diabetes with less than 50 years, with diabetes duration less than 10 years. So this is the risk categories who in patients who are living with diabetes. Then what are the preventive measures? What are the measures you can take to prevent the development of diabetes, or to delay the development of diabetes, or to control your sugar levels? So these are recommendations for primary prevention of cardiovascular disease in people with diabetes. So lifestyle, particularly weight loss, is important who are overweight and obese. You can and along with healthy food habits, you can reduce your fat intake and total energy intake. Fat intake should be less than 30 to 35% of your daily requirements. Increased regular physical activity, long-term weight loss like 5 to 7% of the starting weight, and dietary saturated fat restriction, and replace your dietary carbohydrates by either mono unsaturated or polyunsaturated fats by 5 to 7%. We already seen saturated fat should be less than 7%. These are the nutritional advice. And dietary cholesterol should be less, intake should be less than 200 milligrams per day, and trans fatty acids should be less than 1% of your intake, and total energy intake should be adjusted to achieve your body weight goals. And we already discussed total dietary fat intake should be less than 30 to 35%, and it should mainly compose of mono or polyunsaturated fat, and take good amount of dietary fiber, that is more than 14 grams per 1000 calories consumed, and avoid alcohol to achieve weight loss when your weight loss is the goal, and decrease your plasma triglyceride levels. Reduce your sodium intake if anybody is, because 70% of the people are having a chance of developing high blood pressure. So reduce your salt intake to 1200 to 2300 milligrams per day. It is most important. And physical activity is compulsory of all patients with diabetes. At least 150 minutes of moderate intensity aerobic physical activity, or 90 minutes of vigorous aerobic exercise per week. And you may distribute it over at least 3 days per week with no more than 2 consecutive days without any physical activity. At least you can do 3 days per week, but continuously for 2 days. More than that, don't neglect your exercise. And long-term maintenance of major weight loss, a larger amount of exercise like 7 hours of moderate or vigorous activity per week may be helpful. So what are the goals in patients with diabetes, living with diabetes? You should treat it to achieve your BP to be less than 140 and 90, and without any adverse symptoms, and who can tolerate without any adverse symptoms of the medications, achieve less than 130 to less than 80. And LDL cholesterol goal should be less than 100. And ideally, if you reduce still more, less than 70 milligrams per deciliter for highest cardiovascular risk. And whatever the lower cholesterol lowering drugs you are using, target of at least 50% reduction in the levels of your LDL cholesterol. And HbA1c goal is most important. It should be less than 7% in the absence of any cardiovascular disease, or 8% in patients with severe cardiovascular disease or comorbidities. And every tobacco and alcohol user is advised to quit both the smoking and alcohol intake completely to achieve your goals and to maintain your health in a proper manner and to prevent the future cardiovascular disease goals. So this is the things where the HbA1c level is recommended, that is less than 7 in people less than 75 years. More than 75 years, you can slightly keep a slightly higher target level. So in maintaining good sugar control, sometimes people may experience symptoms of hypoglycemia, so which is important to remember what are the signs of hypoglycemia. So whenever you feel hypoglycemic, you may develop shaking or trembling of your hands, and you can feel your heart rate pounding faster, and you can feel extreme hunger, more sweatings and confusion, difficulty in concentrating, dizziness. This is the important signs of hypoglycemia. So what is the treatment for hypoglycemia whenever you are having these symptoms of hypoglycemia? So this is called rule of 15. So consume 15 gram of carbohydrate whenever your blood glucose is less than 70. And then after 15 minutes, check again your blood glucose. If still it is less than 70, consume another 15 grams of carbohydrate. You can repeat this unless your blood glucose increases to more than 70 milligrams per deciliter. So after it is normalized to more than 70, consume a snack or meal containing a proper meal of complex carbohydrates and protein to avoid again the recurrence of hypoglycemia. So this is most important when you are on more number of drugs and you are aggressively controlling your sugar levels, and aged people. So you should take care of these sugar levels not to dip below 70. So otherwise you will be succumb to more complications. So eat all kinds of vegetables. So what is your plate? Constitutes of vegetables and fruit around 50%, and complex carbohydrates 1/3, 1/4 of your plate, and proteins 1/4 of your plate. So eat all kinds of vegetables, have 2 portions of fruit per day, and eat more whole grains rather than the refined grains, and choose lean meat, plant protein, and dairy products, and choose healthier oils. Better you can eat steamed or boiled food rather than fried options. Always, at least you should know about the basic glycemic index of your foods, whatever you are taking. So high glycemic index like white wheat bread, donuts, all these refined and easily available products are high in glycemic index, and watermelon and cornflakes. So you should better avoid those, and you can take low glycemic index fruits like whole grains, strawberries, apples, milk, oatmeals, and all grains, all these things, vegetables. So all these are in low glycemic index. That is most important. So exercise. So every day, better for your good physical activity, climb stairs, do some regular household works, walking along with your pets. Every 3 to 5 days a week, do cycling, swimming, brisk walking, or jogging, football, or badminton. 2 to 3 days a week, flexibility and strength exercises like stretching up, weightlifting, push-ups, and long press sit-ups, and limit physical inactivity and sedentary work. The aerobic exercises, which are better, like swimming, brisk walking, cycling, jogging, Zumba, parades, and yoga. Strength training exercises like weight resistant and squats, push-ups, sit-ups, you can consider these. So even in children, it is also important. They should engage in outside activities every day as often as plausible. They can play outside, take the stairs instead of the elevator, help around the house. They can pick their own toys, play with their dogs, and they can go for a walk with the family. And similarly, 3 to 5 times a week, like aerobic exercises like skating, biking, skateboarding, swimming, running, and recreational activities, at least 20 minutes like volleyball, basketball. And 2 to 3 times a week, leisure and playtime like swinging, golf, boating, strength and flexibility like some push-ups, martial arts, dancing. They should cut down on the TV, video game, and computer games, sitting more than 30 minutes at a time. So these are also important in kids to develop the childhood obesity and the development of diabetes in later ages. So what are the beneficial effects of lowering your blood sugar? Exercise, particularly on diabetes, it lowers your blood pressure. It decreases the doses of your insulin, lowers the risk of complications like diabetic nephropathy. It improves your muscle health, like strength and function, possible beta cell preservation. It improves your bone risk, lowers the risk of bone fractures, and lowers the risk of neuropathy also, and greater aerobic capacity of and better performance of your lungs. So these are all the beneficial effects of exercise in diabetics, where there are multiple benefits on different aspects. So helps to reduce your weight and even control it, reduce the risk of diabetes during pregnancy, even improves your mood and improves your physical status and improves your sleeping cycle also. So these are the various effects of exercise on a human body, particularly in diabetes, which is definitely required to do exercise activities of at least 150 minutes per week. So the adverse effect, the beneficial effects of weight loss will be there on every organ, on liver, where it improves insulin sensitivity and decreases the content of triglycerides and reduce the fatty liver. It even improves the insulin sensitivity in muscle adipose tissue and improves the insulin secretory function in the pancreas. It lowers the blood pressure and improves cardiovascular structure and function, reduces your triglyceride levels and cholesterol levels, and improves your HDL cholesterol. And it improves your kidney function. So these are all the multiple effects of weight loss on different organs. So who are overweight and obesity, try to achieve your weight and BMI. So what are the screening, what conditions should be screened in patients with diabetes? This is one of the another most important thing. So we had seen already a lot of diabetes patients are prone to develop a lot of complications, particularly if you see cardiovascular disease, heart attacks, BP, stroke, and then peripheral artery disease, heart rate abnormalities, and heart pump failure. So these are all the things where a diabetes patient or person prone to develop. So you should check your fasting lipid profile at least 3 monthly, blood pressures regularly, waist circumference and body mass index regularly, and for evaluating your cardiac function like ECG, 2D echo, and treadmill. And you can get a CT coronary angiogram whenever it is necessary and appropriate. And for even diabetic retinopathy, the retinal screening is important every annual to second annually, particularly in uncontrolled patients and long duration diabetes. Diabetic nephropathy, where you should get your 3 monthly creatinine level and urine albumin creatinine ratio is required every 3 monthly. And diabetic neuropathy, you should check your annual your condition to prevent the development of diabetic foot. You should check about your nerve status. So these are important screening aspects when a person with diabetes should undergo every third monthly or annually. They should undergo some test to prevent the develop of complications. Then one more important is pre-diabetes. This is also most important to prevent the development of diabetes and associated cardiovascular diseases. So when you see diabetes, HbA1c test is 6.5% or above. The pre-diabetes is 5.7 to 6.4%, and fasting blood glucose in diabetes is more than 126. In pre-diabetes, it is 100 to 125, and glucose tolerance test is more than 200. In pre-diabetes, it is 140 to 200. So these are the levels the patients are risk for even pre-diabetes and future on going to develop diabetes. And these people should also be very careful in preventing the development of diabetes and cardiovascular disease. There are a lot of factors that will influence the pre-diabetes condition, particularly age more than 45, female gender, obesity, genetic factors, and simultaneous association of blood pressure and abnormal cholesterol levels will lead to development of pre-diabetes status. So general population should be screened if it is more than 45, and obesity should be screened for blood glucose levels. And patients who are having additional risk factors like hypertension, dyslipidemia, and already having history of cardiovascular disease and family history of having diabetes should be screened for blood glucose levels. So this is very important to prevent the development of diabetes, progression from pre-diabetes and associated cardiovascular disease. So nearly 77.2 million people in India are living with pre-diabetes. You see, these many number of people are going to convert to diabetes by 2045 if you are not able to control properly. So there are different subtypes even in pre-diabetes. They made some 6 clusters, a particular who are obese and having cluster 3, 5, and 6 are having high visceral fat and they're having high insulin resistance. These people are at high risk of cardiovascular diseases and kidney problems. So particularly who are having overweight and obese with fatty liver and abdominal adiposity, visceral adiposity, they should be more careful in taking care of their health and check their regular sugar levels to identify whether they are in the pre-diabetic range or whether they are progressing to diabetes. So this is most important. Then there's a few lines on the continuous glucose monitoring where it is really useful. So there are a lot of factors which influence our blood glucose levels, like food, what type of food we are taking, like alcohol, caffeine, meal timing, and dehydration, and even medications, any other comorbid conditions if you are using, they may alter your blood glucose levels, your activity levels, how much duration and intensity of the activity, and what time of the day of your activity. Everything is going to influence. And even biological factors like sleep, stress, and all these things, puberty, periods, everything is going to affect smoking, alcohol, and environmental factors like sun exposure, what is the outside temperature, and behavioral factors like how frequently you are going to checking your sugar levels and what are the family relationships and social pressures. So there are multiple factors which is going to affect your blood glucose levels. So these are the main factors. So particularly in diabetes, few people need continuous glucose monitoring, like patients with type 1 diabetes who are not meeting their targets or who are currently developing condition called diabetic ketoacidosis and frequent hospitalization. They should preferable for continuous glucose monitoring. Our patients who are developing repeated hypoglycemic episodes or who doesn't know like hypoglycemia unawareness, so they don't know that they are developing episodes of hypoglycemia. So these people should better use continuous glucose monitoring. And particularly subjects requiring better glycemic control and also simultaneously to avoid hypoglycemic episodes, they can also consider continuous glucose monitoring. And even in before or during pregnancy in patients with diabetes and anybody who wants to improve for improving brittle diabetes. So these are the conditions where you need continuous glucose monitoring. There are different aspects like what is in continuous glucose monitoring. One is blood glucose meter, which is regular one, what we see, and continuous glucose monitoring intermittently where you can scan it. And there are advancements in that, real-time glucose monitoring and integrated continuous glucose monitoring. There are a lot of advances are available. There are multiple devices available in the market for monitoring your glucose levels. So this is there is a small transmitter in your skin patch where it will monitor your continuous interstitial fluid glucose, but it's not monitor the blood glucose level. There is small difference between monitoring of the blood glucose levels and interstitial fluid glucose levels. So here you can see clearly there are multiple components of the continuous glucose monitor where you can see a small probe which monitor the interstitial fluid. This is the interstitial fluid glucose levels. So what are the differences between the self-monitoring and continuous glucose monitoring? So self-monitoring is currently the standard of care, and CGM is evolved as an evolving standard of care. It is indicated for measuring glycemia, not approved for diabetes management, indicated for use in routine diabetes management decisions. It provides single point data. CGM will provide almost nearly 288 readings a day, and readings are available with just a button push in CGM. Self-monitoring may miss high or low blood glucose, but CGM may provide hypo and hypoglycemic alerts. Accuracy may be impacted by anemia in self-monitoring. It is impacted by some drugs in continuous monitoring glucose levels. And it requires CGM will require some calibrations, and it detects true patterns of glucose peaks and nades, but self-monitoring only detects patterns based on when glucose is measured. There are some differences between self-monitoring and CGM. The CGM usually better in people who wants to get a better glycemic control and who wants to prevent the episodes of hypoglycemia. So there are multiple systems which are available in the market. Then one is important. People are feeling recent hand topic is diabetes reversal. So usually everybody is having a doubt whether I can reverse the diabetes or not. So up to some extent, it's only possible, but it's not possible in all. So don't expect in every patient diabetes can be reversed. So it's not correct. So diabetes reverse is possible on a few subset of population with strict recommendations following healthy lifestyle. So what is meant by diabetes reversal? So usually complete reversal at 3 months, like if your fasting blood glucose is less than 100 milligrams, partial reversal, you can tell if it is between 100 to 125. Even like remission, after reversal, you may get again the development of diabetes. That's called partial remission, like fasting blood glucose of 100 to 125 and HbA1c of 5.2 to 7.4% in pre-diabetic at 1 year or later. Complete remission, that is, you completely got rid of diabetes, you can call is whenever it is less than fasting less than 100, HbA1c less than 5.7 at 1 year or later. So it's only possible to tell that your diabetes can got reversed or completely gone until you monitor for 1 year continuously. So for this, strict diet is important, that you should take your intensive lifestyle therapy with your daily caloric intake of 1500 kilocalories, 60% carbohydrates, 15% proteins, and 25% fat, and brisk walking for every 1 hour per day. So there are some criteria for remission for type 2 diabetes from British Clinical Diabetes Association. That is, weight loss should be there, fasting plasma glucose less than 100, or HbA1c less than 5.7 on 2 occasions, separated by at least 6 months. So you should get these levels at least with 6 months gap. You should get the lower levels of fasting plasma glucose and HbA1c, and particularly these parameters after complete cessation of all glucose lowering therapies. That is most important. While on drugs, we can't label it as complete remission. So you should be completely off the all glucose lowering medications, and with intensive lifestyle therapy along with weight loss and regular exercise, you may able to achieve this. So that is most important. So it is only possible in those with diabetes is reversible is only possible in some patients with type 2 diabetes, particularly with very short duration, or who practice like severe weight loss and very severe calorie restriction. And it is not reversible in patients with type 1 diabetes. Diabetes is not reversible. Remember this point. And also with the type 2 diabetes, who already developed complications. We have discussed a lot of complications like coronary artery disease, peripheral artery disease, brain strokes, kidney problems, vision problems, neuropathy. Patients who already developed all these complications, it's not reversible, or who are in the late stages of the disorder where they developed a complete insulin deficient of type 2 diabetes. In them also, the reversible diabetes is not reversible. This should be kept in mind. So there are a lot of things regarding low or very low carbohydrate diets. So it improves your cardiovascular risk for up to 2 years, and long-term outcome data is not available with the very low or very low calorie diets or carbohydrate diets. And there is randomized control trial evidence. There is 6 months weight loss is achievable with the practice of low or very low carbohydrate or low or very low calorie diet, but it should be followed by high protein diet to maintain remission, or a Mediterranean diet to keep your weight under control. So what is meant by very low carbohydrate diet? That is 20 to 50 grams per day, that is less than 10% of energy. Low carbohydrate from 10 to 26%. Moderate carbohydrate is 26 to 45%. High carbohydrate is more than 45% of your intake per day. So finally, what are the tips for diabetes reversal who want to achieve in early stages, like strict diet, low calorie or low carbohydrate, minimum exercise of 150 minutes per week or 30 minutes per day, weight loss, especially around the waist area, particularly who are overweight and obesity, and in morbidly obese patients with all these complications. So bariatric surgery can help in weight loss and associated with diabetes reversal. So these are some tips for diabetes reversal and control. Also, you should practice your healthy lifestyle with well-balanced diet, and regular exercise is a must to keep your sugar levels under control, and weight loss is also must. So if you practice all these things, you can able to control your sugar levels within the range, and you need regular checkups of your blood sugar levels, particularly HbA1c level every third monthly, and regular screening programs who are already having diabetes and its complications in patients having diabetes. So this is the today's talk on the diabetes and development of cardiovascular diseases. So I hope the persons who are having diabetes should take care of their health, and they should screen for the complications, and they can get check their blood sugar levels regularly, and along with HbA1c every third monthly. And they will and I think hope you should maintain your lifestyle very healthy with well balanced diet and regular exercise, and for weight loss in overweight and obesity patients. Thank you very much, and for this opportunity.
So thank you, sir. Thank you for enlightening us and all the participants with your insightful presentation on diabetes and how it affects with cardiovascular diseases. So at Onus Hospital, we have a complete cardiac checkup, that is at rupees 999 only. So all the patients, of course, we can suggest all the patients who are suffering, of course, who are having diabetes, and they are definitely at increased risk. So they can come to Onus Heart Institute and get checked for cardiac clearance. That is at just rupees 999, where it includes all the tests like ECG, 2D echo, TMT, random blood sugar, cardiologist consultation, and dietitian consultation also. It is only just to create an awareness among the population. We have introduced this just low 999 rupees offer for the people, for the benefit of the people. So we can suggest your patients, or you can suggest your friends and relatives to come and get checked for cardiac clearance at just 999 rupees only. So with this, we close our presentation for today's webinar on diabetes and how it affects with cardiovascular risk diseases. Thank you very much, all the participants, for taking out your time, valuable time, and participating in this session, webinar session. And again, we will have a next session on next Saturday. We will again meet in the next Saturday, same time. Thank you. Thank you very much.